the knee. Okay. Anterior, right? How do I know anterior? Because the patellar surface.
Right.
Posterior, how do I know? Because of the intercondylar groove. That's how I know.
Okay.
Okay? So, plus on top of that, there's a kneecap.
The knee.
That's a dead giveaway.
Right.
Right? So notice the kneecap is enclosed in a ligament and a tendon. Okay? Oops, a tendon and a ligament. Because your quadricep muscles are up here, that's going to attach to a bone,
Right.
and your bone is going to attach to a bone. Ligament, tendon. So this part is the quadriceps femoris tendon. Whereas this here is a ligament for your kneecap. So we'll call it the patellar ligament. Keep it simple. Yeah? Yeah? Okay? Everybody good? Okay? So what we're going to do now is we're going to look. Now, we have to know what is lateral and what is medial. I know this is medial because of the tibia, because that's the medial leg bone. What is the lateral leg bone? The fibula. So this must be lateral. So that's why this is medial and this is lateral. Big bone medially, laterally. Oh, very good. Okay. He says little bone, lateral for little bone. Okay. So that means we have collateral ligaments. Okay, we have collateral ligaments. Collateral. Yeah, collateral ligaments.
Okay.
That means we have collateral, which is here, and collateral, which is here.
Okay.
So that means this is the medial collateral or the tibial medial collateral.
So can't we just say medial instead? Like have
Good
this
question. Because sometimes we call a car, and sometimes we refer to it as an automobile.
But don't you have like a and you have like a medial meniscus and a lateral meniscus. You can get them messed up.
What did you say? Right?
Okay.
So there are just different names that we associate with, right? Which is the same structure. Yeah. And laterally, here it is. Laterally, because that's my fibula, right? This is the fibular or lateral collateral ligament. Okay. So we pretty much check those off, yeah? The tendon, the ligament, and the collateral ligaments.
So are they gonna be able to show us like a meniscus? Is that gonna be pointed out?
Yeah, we'll see.
Yeah.
Okay. Then what we're gonna do is we're gonna expose the interior structures. Okay? And when you expose the interior structures, okay, if you look in here, okay, you see a cross ligament, cross,
Yes.
one that is crossed anteriorly, one that is crossed posteriorly. And they're going to form a cross or a crucifix. Yeah, isn't that what a crucifix is? A cross. So this is your cruciate ligaments because it forms a crucifix. So that means the one on the anterior, anterior, cruciate ligament, and posterior cruciate ligament. Okay, cruciate. Okay.
Your ACL.
So, yeah, this is your ACL and your PCL, your anterior cruciate ligament and your posterior cruciate ligament. Okay. Then, in addition to the articulating cartilage, hyaline cartilage, right, our cartilage, you also have a disc in between the cartilages.
Which is your meniscus.
Okay. So what I'm tucking on, notice is medial aspect, yeah? How do I know this is medial aspect? The tibia. It's tibial side. So this is my medial meniscus, and here is my lateral meniscus. So in...
So the disc is called meniscus?
Yeah, the meniscal disc. Okay. So in contact sports, i.e. football, okay, somebody gets clipped from the lateral aspect. How do I know this is lateral? Because of the fibula. Look what happens. The force is going to tear, yeah? Notice it's going to be applied medially. So that means what's going to tear? Medial collateral ligament, anterior cruciate ligament, and the lateral meniscus.
Because this doesn't change.
That's what we call the unhappy triad.
Yeah.
Because three structures are being affected. Okay, in a lateral impact of, for example, American football, right? Because football outside of America means soccer.
Right.
Okay, American football, or any sports that pretty much clips you in the lateral aspect.
So
Okay.
you mess up your PCL, your ACL, your meniscus.
You mess
Or
up the medial collateral MCL,
Yeah.
your anterior cruciate ACL, and your lateral meniscus. Okay, done. Next. Shoulder. How are we doing so far?
That's pretty. That makes
Straightforward.
so much more sense.
Straightforward. Okay. Straightforward. Okay.
Yeah. Are you? We don't have an elbow, do we?
No.
Okay.
I thought we did, but I'm gonna talk to him about the elbow.
All right.
There is one, but I'm gonna talk to him because I have to redraw this.
Oh, can't we use that one? Oh, yeah, did you?
I'm gonna have to redraw this.
It doesn't match what's in the menu.
I'm gonna have to redraw this. It's gonna be the same answer. I'm gonna have to redraw this.
Okay.
Okay. So let's take a look here. Notice this elbow. This elbow. The shoulder. Is this shoulder? Yeah. Anterior view. How do I know this is anterior view?
The spine is on the other side.
Yeah, the
other
spine
side, yeah.
is on the posterior aspect. I do not see a spine of the scapula here.
Right.
Okay, that's how I know this is anterior.
Okay.
Yeah, because the spine of the scapula is always posterior, not anterior.
And your clavicle comes forward.
Yeah, obvious clues. Yeah. Okay. Then what we're going to do is notice. What do we call this cavity where the humerus sits in? What do we call that cavity on the scapula?
Falling.
I don't know.
Surface cavity.
What is it?
Scapula. No.
How about glenoid
Glenoid.
cavity? Yeah, glenoid cavity. Glenoid cavity, head of the humerus. In other words, glenoid, humerus. Why don't we call it the glenohumeral capsule? Glenoid.
Okay.
Oh, wait, so this is an tendon? Because this is muscle. Oh, maybe.
Underneath it. Underneath.
Oh,
it.
no, no,
Underneath
underneath
What
it.
the
Oh.
bone
Underneath
goes
it.
into. Yeah.
Oh, okay.
Yeah, underneath it is the tendon. You're right. Underneath it is the tendon, but above it is the ligament.
Okay.
This one is a ligament.
No, this is the
Underneath
tendon. Is the underneath it is the ligament,
ligament,
and then
this is
the tendon because it's muscle.
the other way around. The other way
How
around.
do you know?
Maybe from the outside.
Use this
Tendon connects the bone.
because
Bone.
notice in this drawing, the muscle
I
strip.
don't know why I know that right now. But
I understand that.
And when we're looking at joints, they're usually held by both tendons and ligaments. Both.
Okay, and how can you show in the graphical, for example, on this model?
it's white.
What is that?
Where my fingers.
What's
ID
that?
structure.
Okay, what we say is tendon or ligament?
Whatever your choice gives you. Your choice won't ever give you both.
Wait, so Dr. Chung, that's the glenoid?
Wait, let's answer one question at a time. The question here is, how do I know this is a tendon or this is a ligament? Whatever your choice is given to you, both of them will never ever be on the same.
Oh, okay, that
And a
makes
tendon
sense now.
connects bone to
because-
bone, right?
I won't say, oh, this is the tendon to the subscapularis, or is it the glenohumeral ligament? No, that won't happen. It'll be one or the other, not both.
Okay.
Okay?
So if we know the area, then we
Yeah, if you know the area, then it gives you a general idea. Yeah? So, glenoid, humerus, head, articulation. So why don't we call it the glenoid humeral ligaments?
Right.
And that's this whole entire ligament here. Okay? The next two ligaments, 1, 2. Okay. 1, 2. Okay. 1,
That's a
2.
ligament. This part right here is
Yeah.
the ligament?
Yeah.
Oh,
Two
okay,
ligaments
okay, I
here.
didn't see
1, 2. 1, 2. Okay. Notice clavicle. Yeah. Clavicle.
Yeah.
Okay. And coracoid process of the scapula. Yeah. Coracoid process of the scapula. Yeah.
So you get.
So why don't we call it the coracoclavicular ligaments?
Okay.
How do you say that?
Coraco for coracoid or coracoclavicular ligaments.
Alright.
Name it. for the attachments. It's a ligament, yeah? Name it for the attachment.
Oh, okay, I see.
This isn't. These are not there. We're talking about.
These two here are these two here.
Oh,
Okay.
okay.
But if we're going to ask you, we're going to ask you the bowl type name, right? Not the individual names.
Okay.
Okay? So we're going to ask you collectively.
Okay.
Yeah? We're going to ask you collectively. Okay?
So you're working on the top right here?
Those
These
first two.
Those two
Yeah.
is that
As-
big word.
And you're gonna
Notice the name tells you what it is. It says coracle or coracle, the coracle process of the scapula. That's why you have to know the parts of the bones.
Okay.
And the clavicle. So why don't we just call it the coracle
Okay.
clavicular ligament. Okay? Then the next ligament here is going to join the acromion process. Yeah. How do I know this is a acromion process and not coracoid process? Because if you follow the spine laterally, it ends as the acromion process. That's how I know.
Okay.
Okay? Because the coracle, the coracle process is not part of the spine. It's detached from the spine. There are no association to the spine.
So which one?
But if you follow the spine, then it becomes the acromial process. Right? It becomes the acromial. So let's see, clavicle, acromium. Right? So here's clavicle, here's acromium. So why don't we call it the, right? The acromio, right? Acromio clavicular ligament.
That's just that. That's just a process right here.
Yeah, just this portion right here.
All right. That's just it.
Yeah.
All right.
Now this portion here, this portion here,
Right.
this portion here, right? This portion here is this portion right here. See that?
Okay.
See that? See that?
Yes.
See that?
Oh, so this is.
Should do more. Like,
Nope, I'm pointing to this now.
Yeah.
Don't-
I
don't
was
move.
just
Okay? Sure.
fixing something in my.
Okay, see that? But this time is the coracoid process to what? To the acromion.
It's not
Yeah?
this one.
Yeah?
Isn't it this one? This one is at that.
You guys have to pay attention. Okay? Acromion process,
Right.
coracoid process. Let's call it the coraco acromial ligaments.
So that's just from here to here. This way.
Connecting us.
That's it.
That's it. Okay.
Okay?
That's
That's it.
just the middle one across.
That coracal acromial is right here. Yeah.
That's it.
right there.
Okay.
Whereas
Here.
Yes.
that one,
It's just the top.
notice it's just acromio clavicular, yeah? Acromio clavicular. Okay?
Okay.
That's it.
All right.
Yeah?
And then
Okay.
this one is just.
Then this is the coracrohumeral, which we don't have because there's no attachment from here to the humerus. Right? The name tells us.
But that. Okay. So that would just go across, like
If it would, it would go across from here to here. Coraco.
from here to here.
Yeah,
Okay.
yeah.
Okay.
Okay.
But with this one,
Okay.
so that one's out.
Okay, so let's see what do we have in the posterior. Oh, that's it in there too.
That's it, right?
Folks, that's it. Okay, next. 3. That's it? All right, everybody goes home.